What do you think that has changed in this outbreak that makes the situation so worrying?
Well, many things have changed, Albert. Many things. One of them, maybe the most important one, is the fact of, for example, dividing the situation in different epidemiologic settings. In the European scene, the main problem is being posed by the wild fauna, specifically by wild boars. It is the main mechanism for the spreading of the disease. And of course, right now, the main problem that favors this is that we have had a wild boar overpopulation in the last years that represents 600 to 750% in the case of some farms. And then, actually, this is important because such a great population makes the outbreaks be nearer to each other, and therefore the spreading of the diseases becomes easier. On the other hand, in the non-EU Europe, apart from this problem with wild boars, the biosecurity on the farms is weaker than in the EU. In fact, in the EU, what we have are outbreaks in wild boars with the odd outbreaks in domestic pigs, whilst in Ukraine, Belarus, or even Russia, it is just the opposite. There is a great number of outbreaks in domestic pigs and a lower number in wild boars. Therefore, all these circumstances make that, epidemiologically speaking, the situation is a bit different depending on the region, right? The last time, in 1962, that time the basic route of transportation was through food. This is, the workers took food to the farm carelessly, thinking that they were not at risk, and some leftovers were fed to the pigs. Then there were sporadic outbreaks in some European countries that were controlled immediately, with the exception of Sardinia, where the 1978 outbreak is still currently active. These are some of the main differences.
Which would be the recipe to avoid the entry of African swine fever into a country? The recipe as veterinarians, I mean.
In fact, there is not a single recipe to control a disease like ASF. There are many parameters to bear in mind to see how the disease spreads. Therefore, ideally, a hazard analysis should be carried out, and we should see which is the greatest hazard in each area and situation. But if you ask me about a specific continent or country, I would tell you which would be the mechanisms for the spreading of the disease. As a general recipe, there are 4 key factors. The first one is that it is a tremendously resistant virus. This is, it can remain in a carcass or food for days or months while being completely active. In second place, the virus is extremely active in blood. 1 drop of blood, so you can get an idea, contains more than 3,000 copies of the virus. Therefore, if some drops that have not been cleaned and disinfected remain on a lorry, we will have an important virus source. We also have the evolution of the disease in wild boars. Both in wild boars and domestic pigs, we perfectly know that the disease is evolving towards milder areas or forms, and therefore we cannot expect only mortality, but that there are animals that survive. The animals that survive are carriers that are generally more difficult to detect, especially if the detection of both the virus and the antibodies are not carried out at the same time. This is another issue having to do with the risk, and in some areas it is very high. We also have the issue regarding food. Nowadays there are more workers on the farms that come from different countries. They are great, very good workers, but they come from infected countries, and what we all know for sure is that if there is something that people miss when they live abroad, apart from family and friends, is food. These people will bring food with them when they return from their holidays in their homeland, and many times they do not have the knowledge or the training enough to know that the food that entails a pleasure for them can be another of the risk factors. Therefore, depending on the region, we have the following situations. In Asia, Europe, Belarus, Romania, including the European Union but nearer to Ukraine or Russia, they have a certain symptomatology and epidemiologic conditions, and then we have Spain that has others. Therefore, depending on that, I would give the recipe, but we cannot provide a single and universal recipe yet.
I would like you to comment about which biosecurity members should be implemented at the farm level. What aspects are important to avoid that the virus enters a farm? What can we do to protect ourselves from the virus if we are affected at a national level?
If the whole country is affected, the first three ones that I have told you must be expanded. It is not only wild boars, cars, piglets, lorries, or food. We must add the visitors, the veterinarians, the people who come to buy livestock. This is, the staff or the visitors must not enter the farm without changing their clothing. No outside clothing must enter our farm. That is the first and foremost thing. The second aspect has to do with the lorries. Anything that comes near the farm must have been cleaned and disinfected, and the circulation of lorries must be controlled. This is another vital thing to do. The third one, as I told you before, is that our team is ready to detect something different. And for that detection to be really effective, they must not wait until the kidney, liver, or spleen are infected. There may be 2 or 3 symptoms, but you must know which is the most significant one, because that can give you an indication. And then you must be brave enough to notify the disease. Because in this kind of matters, as you probably know, nobody in the world wants to win the gold medal. Everybody fights for the silver or the bronze medal, but almost anybody for the gold medal. This is probably so because in most of the cases, when there is a notification, there is an estimation, and this is very detrimental if the result is negative. Although this situation should not happen with the technology available, and I think that we should improve this greatly because it is vital that we collaborate in the early detection of the disease.
At a professional level, Jose Manuel,
Tell me.
now you are a field veterinarian.
Yes, I love that.
When you go to a farm, which symptoms or lesions would make you think that you have an African swine fever outbreak or would make your alarm bell ring?
I will divide that into 2 possibilities. One is that a highly virulent virus enters the farm, and this is very probable. Right now, viruses with a high and medium virulence are circulating, and even asymptomatic viruses. This is what is circulating right now. Therefore, let us imagine the 3 settings. If a highly virulent strain enters, we will see animals with a fever, the external tissues, ears and belly with a generalized erythema, animals that feel cold and that try to huddle. And this shows that they are animals that are suffering a disorder that causes a high fever. What we must do with these animals is perform a necropsy. In the case of African swine fever, that necropsy must be performed under certain specific conditions. Remember that blood is a magnificent vehicle for the disease. The virus sticks to the red blood cells and uses them as if they were a bus to move around. And a single blood drop contains several buses loaded with viruses. Therefore, we must perform the necropsy under appropriate conditions to ensure that nothing will remain infected, or that we may carry it beyond that farm with our footwear. It is important to perform an orderly necropsy towards the target organs because they are essential.
That's what I was expecting. I'm intrigued.
You are intrigued? Then where do you want me to start? Let us start from the outside with the skin. Let us take a look at that erythema. We will even see darker areas or larger hemorrhages, and as we open the carcass, we will see 2 important images, that in the thorax and that in the abdomen. In the thoracic image, we will find hypopericardium and fluid in the lungs and in the heart cavity. We will find lots of fluid because the African swine virus affects the macrophages, and the endothelial cells too, so it causes a diversion of fluids. This is something that must draw our attention. We will sometimes see lesions in the lungs, with very congestive areas, with initial pneumonia lesions, because the virus is also affecting those macrophages that are the target cell for the virus. From there, we will go to the abdominal area to pay special attention to the following things. Splenomegaly. That is one of the things that we will see that has a size that is larger than normal. Although sometimes this does not happen. The spleen is much darker, as if it was congestive, hemorrhagic. But sometimes a smaller spleen can also be very congestive. After that, our main markers are the lymph nodes that are normally affected, and here we will find two kinds of lesions. In one of them, the lymph node will be simply congestive, and in the other case, it will be a mere blood clot. If they are mere blood clots, the probability of having the virus is very high. If they are congestive, there may be a disease, but their number will not be as large as in the case of African swine fever. This is the basic difference. We will find a great number of affected lymph nodes. The renal lymph node, for example, is a typical one. There are several lymph nodes that are really important, and 3 or 4 lymph nodes affected like that should warn us that the situation is serious. The kidney sometimes shows very small petechia, and sometimes not. And therefore we will have to see if the lungs are affected, if there is hypopericardium, and then, after descending, see if there is splenomegaly and affected lymph nodes. If we later look at the rectum and also see congestion in the intestine, petechia, and hemorrhages, then we should really become alarmed, especially if we know that the virus is in our country or almost entering our country. What's happening here? What happens is that there are braver and more faint-hearted farmers and colleagues. Why? Many times when the farm is going to be inspected, we remain there for longer than needed, therefore stigmatizing the farm because everybody already knows that the farmer is surrounded and all the activities on the farm have stopped, and the diagnosis may turn out to be negative. Therefore, it is important that we all fight together so the farmers and the veterinarians trust the authorities, and that they talk about an event that is completely normal and that could happen to anybody, so they do not feel stigmatized. And then to our administration, that because it has the means to do it, carries it out more quickly, that 2 inspectors may be there waiting for the diagnosis, because this takes 4 hours or 5 at the most. And during that time, any person can be there without causing disturbances. 5 hours later, the diagnosis will arrive, and if it is negative, the farmer will be reassured without having harmed or stigmatized them. I think that this is something towards which we should work together to help each other.